and it's in the breaking. We come unbound, and it's in the giving. We are found, yeah. You could barely change.
Welcome to A Medicinal Mind, Wisdom and Wellbeing, a podcast dedicated to the telling of authentic stories and the sharing of insightful wisdom, exploring science and spirituality, medicine and Mother Nature. No topic is off limits when it comes to growing our personal understanding and supporting our collective well-being. With your host, Dr. Rob Abbott, a family medicine resident practicing spiritually focused and evolutionarily informed functional medicine, we hope to nourish your being so that you can flourish in whatever the moment has called for you to do.
And I know you try.
In episode 59 of A Medicinal Mind, Wisdom and Wellbeing, I have an explorative conversation with my functional medicine colleague and dear friend, Dr. Joe Mather. Having connected with Joe as a result of our mutual friend and colleague, Michael Ruscio, our friendship has quickly blossomed, bringing together two functional medicine practitioners seeking value-based care and a critical eye to this new root cause resolution approach. After sharing his story of supporting his mother with a functional medicine approach, Joe outlines the clinical importance of addressing foundational concerns with all of his functional medicine patients, regardless of the overt presenting symptoms. Outlining skin rashes, IBS, and joint pain as the most common presenting conditions he's seeing clinically, Joe provides some insights into his clinical approach as to how he is determining the root level of dysfunction in these myriad of conditions. Digging deeper into how he's addressing gut health dysfunction specifically, as well as the overall stages of his clinical approach, Joe gives us a clear and concise framework by which compromised gut health can be addressed without unnecessary testing, supplements, and medications. Emphasizing the importance of addressing the terrain over the overt condition, Joe reports how he's preventing recurrence of conditions by treating the terrain over simply symptoms alone. We then get into a thoughtful critique of functional medicine, collectively sharing insights regarding the strengths of functional medicine, as well as some of the more controversial, misguided approaches, such as food sensitivity testing, isolated genetic testing, and expensive testing in general. Moving further into the role of medications, Joe shares how he's moderating medication use, not completely eschewing medications in lieu of supplements and herbs. Giving examples such as genetic predispositions to elevated Lp(a), as well as excessive supplementation alone, Joe shares how he is careful to utilize all available tools to address chronic health conditions. We close the conversation with a thought experiment, exploring where functional medicine can go next, so that we can address some of the more controversial areas lacking rigorous evidence, all with the intention of increasing education as well as improving the gold standard of root cause resolution care. I'm so grateful to be able to share the work of another colleague who is practicing value-based and rigorous functional medicine care. And with that, let's dig into the show. Well, Joe, thank you so much for joining me today on a podcast. I missed out on the first Joe podcast experience, so I'm feeling like I need to get a good conversation with you. So happy 2019 and welcome to the show.
Thank you. Well, this will be my second podcast, so still a newbie.
Oh man. Well, I when this whole thing was kind of coming together, I was talking with you and with our good friend, Mike Ruscio, and unfortunately my sort of schedule just didn't quite work out. And you guys had an awesome conversation. I think a really much needed conversation in this space. But it was still, for me, too short. I think we needed really to get into maybe some more topics and things that really they're growing out of this greater movement in functional medicine. And I thought you'd be the perfect person to have that conversation with. So, but before we get into all that, I wanted to at least give you an opportunity to kind of let people know a little bit about yourself and, what's your background in medicine and how the heck did you even come to enter the functional medicine space?
Right. Well, I kind of knew from a young age I wanted to be a doctor. It was just something on my radar for a long time. And, following college, came to New Orleans for medical school at Tulane. Loved the city, just loved New Orleans, and stayed here for my family practice residency. I was really interested in treating kids and adults and just all different types of diseases. And so family medicine was just such a great fit to get a good broad base of knowledge, medical knowledge. And in the course of the residency, even though I was being taught by wonderful doctors, caring doctors, very experienced, great physicians, I just felt that there was something more out there. I felt there must be more that I could offer patients. And I kind of entered the functional medicine world just out of curiosity and frustration that the tools I was taught just didn't seem to make my patients better. I could prolong lifespan and manage disease, but there really wasn't very many options of how to reverse disease or make people, feel fundamentally better. And that's where I entered the functional medicine world. And so I've been in practice doing purely functional medicine for about 2 years, and I've been just studying and working at it for about 5. So,
Yeah. So, and I think everyone can agree in this space. Usually it starts with an experience either with your personal health, a family member's health, or, a lot of professionals. It's just that sort of just sense of I'm not helping anybody, and that curiosity to really find out what's at the root of their experience is leading people to this space. And it's clear that was something that was guiding you. And I'm just kind of curious, was there even like an index case or like a really pivotal moment? Where was your ground zero, so to speak, to even enter functional medicine?
My mom has rheumatoid arthritis, and on a tremendous amount of drugs that were helping suppress her symptoms, but coming at some pretty intense side effects and potentially long-term cost. And so I wanted to do a better job at figuring out if there was anything to offer her. And that kind of led me to the realization of the importance of the gut health and autoimmune diseases. Rheumatoid in particular, there's just such overlap there between infections and imbalances and joint pain that seemed a good place to start. And in kind of surveying the functional medicine landscape, I was really looking for toolkits that would most quickly help my patients, because there's a lot to choose from in the functional medicine world, and it seems like a lot of different doctors have a niche or a pet theory or pet mechanism or pet supplement or pet test. But I was just interested in getting results for people, and so after experimenting with a couple different approaches, landed on the gut as the quickest way to get people feeling better. And so I was able to help my mom feel significantly better and lower her medications just by tackling some gut issues.
And that's something I think, obviously, I've mentioned, Mike Ruscio in the beginning, his approach, and he's really becoming one of the biggest names in this space for addressing gut health in relation to a greater functional medicine approach. But obviously, we sort of have a resonance there with that. But I think you can also, like you kind of also mentioned, people use terms in this space quite broadly, and someone has a catch-all. Like how you were saying, someone's pet supplement or pet test or pet approach or pet mechanism. And I think we can sometimes get lost forgetting that, yes, there is a lot of other things going on, and that we have to maybe suspend our disbelief in any given moment to engage in one area, whether it be the gut or hormones or thyroid function, what have you. But I see a lot of folks still getting confused with, everyone has leaky gut or everyone has this or that. And we all know that, it's not as simple as that. And making those kind of conjecturous claims are going to be somewhat damaging if put in the wrong context. So I was curious, when you mentioned the gut being your sort of starting place, and while I might kind of know your answer to this, for the audience, outline for folks what you really mean by addressing gut health, and perhaps systematically, how are you going about looking into that? And then going forward, we'll get into maybe your therapeutic approach.
So for me, when I start working with a patient, I try very hard to first build the fundamentals of health. And for many patients who come to see me, they have just poor fundamentals. They've never really tried an anti-inflammatory whole foods diet, one version of the other. They're sleeping poorly. They're not moving. They have tons of excess stress. They may be nutrient deficient. And so for me, I kind of start there. But then for the patients who are doing those and not getting improvements, that's when you start to kind of peel the onion back. And the more I do this, the more impressed I am with how many people are walking around with pretty massive chronic GI issues. So for me, potentially, especially if the patient is ill, I'm going to start off with some sort of gut testing. And I look for SIBO very frequently in my symptomatic patients. And I typically do a stool test to screen for bacterial or yeast dysbiosis and potentially parasite infections as well. And that approach, just trying to keep it very, very simple, has yielded really good results for a lot of different types of diseases. And so that's my general starting point, and just try to keep it as simple as possible for people. There's so much complexity in this, and that sometimes we just need to take a step back and figure out ways that we can make it approachable and easy for people. So it might be as simple as adding some good bacteria with probiotics and using some herbal or pharmaceutical prescriptions to reduce the amount of bacterial or yeast overgrowth, just to bring the gut back into balance. And the approach may be as simple as that. It's obviously, patients sometimes need a whole lot more, but that's generally how I start working with patients.
And then, so I think for some people, depending on if they're a patient themselves or, a practitioner, it may seem obvious to go to the gut when they're having symptoms such as bloating or excess flatulence or diarrhea or loose, some other, abnormal stool pattern. But we're starting to see that, yes, maybe those overt symptoms that we would almost directly think of the gut are only the tip of the iceberg, and that there's a lot of other things that are going on or can go on outside of what we consider a strict gut symptom, but that have a underlying root imbalance in the gut. And so maybe you can outline for folks what are things that you're looking for as a trigger to say, okay, maybe this is something that really should have me looking towards the gut, but it's not something as obvious as, hey, loose stools, constipation, bloating, what have you.
For me, the three most common extra GI symptoms, so symptoms outside of the GI tract, would be brain fog, number one. Number two would be skin rashes, and three would be joint pain. Those are the three things that I see the most, and maybe insomnia being number four. So I've had several patients without GI symptoms that, sure enough, had major imbalances that needed to be fixed. And when those issues were fixed, then skin cleared up or they slept better. Those would be the four.
And what is making you think, we use the terms dysbiosis, or you mentioned small intestinal bacterial overgrowth. There can be different pathologies or issues going on in the gut. And obviously there can be overlap. So I think, for myself, right, if something is going wrong in the small intestine, or there's a bacterial overgrowth in the small intestine, it's really likely that there's also an environment in the colon, in the large intestine, that's probably not optimal. But give me a sense of, what are things, how are you systematically going through someone's symptoms or presentation to decide what forms of testing for maybe more specifically small intestinal bacterial overgrowth or more, dysbiosis or, a parasitic infection in the gut? How are you going about making that decision tree and diagnosis?
So the patients that come to me with pre-existing IBS, irritable bowel syndrome, I will almost always start with a comprehensive stool analysis and almost always do a breath test right off the bat. Because more times often than not, those tests just haven't been done. And there's such a good chance of getting people feeling better if something is found on those tests that I typically start there. Is your question more, what are some of the symptoms that may make me think someone has SIBO, or?
Yeah, so kind of going back to, right, maybe the extraintestinal, extra GI symptoms that may be triggering you to think there's something going on in the gut, and maybe putting you down the pathway of more, maybe this is small intestinal bacterial overgrowth, or maybe no, this is more primarily a issue, I think, in the colon. So you outlined clearly with IBS, you're thinking, yes, okay, this person has overt symptoms, and I like your approach because it's similar to mine. If it hasn't been done, let's really assess both it, as best as the surrogate which we can get, but the breath test, small intestine, and the sort of bacterial profile, organism profile in the gut. But in other situations, with our value-based approach, how are you going about sort of saying, okay, maybe in this instance, I'm going to start with, and biggest bang for my buck, with the stool test, or no, this really sounds more like maybe a primary dysbiosis in the small intestine.
Okay, so in my experience, the two cardinal symptoms that make me more concerned about SIBO as a primary cause of disease would be bloating after meals for SIBO and brain fog. If those two things are present, then the chance of them having SIBO, in my opinion, is fairly high. And so I'll start with the breath test. Now, if someone is having more chronic fatigue and then more obvious GI distress, like chronic diarrhea, that is kind of tipping me to believe that there might be more of a chronic colonic infection. And so I may start with a stool test. But one of the nice things after having done a whole bunch of stool tests and breath tests, I found that if the approach that I've learned from Dr. Ruscio and I've applied to a lot of my patients, building that foundation, using the proper supplements, not too many, but the right ones, and then often a course of herbal antimicrobials can fix a lot of issues. So sometimes that can really, if there is a coexisting yeast infection with SIBO, if you're just treating the SIBO, you're going to improve the health of the colon as well. I mean, they're connected, right?
Yeah.
So there is some cost saving potential there, but it really depends on the complexity and the illness of the patient. The sicker they are, the more likely I am to request they do more testing, just because I don't want to miss something. And if a patient's seen 9 doctors before me and they're just at the end of the rope, then I really want to not miss anything and give the most direct treatment I can. Now, if someone is just having mild symptoms, then I think there's a definite argument to just try treatments, because the treatments are relatively inexpensive and fairly easy. You could just monitor the patient's response to the treatment as your diagnosis.
Yeah. No, I think that was incredibly helpful. And then I guess, you mentioned sort of non-specifically, broad terms, your treatment paradigm. And if folks are familiar with, Dr. Ruscio's approach, sort of a stepwise approach to treating what may be found on these types of tests. So, dysbiosis in the gut or dysbiosis in the small intestine, walk people through what it is you're doing at each sort of tier of your therapeutic approach. Because I think, we both kind of agree that, well, certainly you could immediately go to herbal antimicrobials when you identify a dysbiosis or potentially susceptible organisms. Maybe that isn't the first thing that you do, and obviously there's nuances to all of this, but maybe in a broad sense, walk people through that stepwise approach or how you're going about it.
Well, I think the thing to realize is that their bacterial or yeast imbalances in the microbiome don't just happen by accident. There's a reason for why they're happening. So in some cases, it's just a horrible inflammatory sugar-based diet that's feeding improper bacteria. Sometimes it's overuse of antibiotics. There have been a couple discussions, I think on Dr. Ruscio's last podcast about SIBO potentially being an adaptive response to sulfur metabolism. So thinking about why the imbalance is there is very important. And many patients have kind of come in to see functional medicine doctors because they've been treated with antibiotics or herbals online and they haven't gotten better. And the step that was missed was that a foundation for good GI health was never built. They hadn't made enough effort to heal leaky gut. They hadn't improved the nutrient quality. They hadn't fasted to cool down inflammation, added probiotics to support their immune system and their balance. And so if you just kill a bacteria without changing the terrain of the colon or the small intestine, then the bacterial dysbiosis will just come back. And unfortunately, people are still maybe operating under the conventional kill model. If the bacteria is there, you have to kill it rather than trying to nudge the whole system back into health. So setting that healthy foundation is very important.
Well, I think when we really get to what is functional medicine, if you're really looking for the root causes, simply treating, we can consider SIBO a root cause, and it is in some ways, but it also is just a sign of what you said, something else going on in the terrain that's disrupting this ecosystem. And I know I certainly see, and this is just, I think, a function of our current medical structure, tons of folks who have various abdominal surgeries. Gallbladder is very, very common. And women, you can certainly have people with cesarean sections. Abdominal surgery is much more common than we really realize. And anytime you enter the abdominal cavity, clearly it's a traumatic event, but adhesions become a huge issue. And that's certainly something that doesn't just disappear with herbal antimicrobials. And so these, refractory cases, or like you said, in terms of if there's another pattern of illness that's requiring antibiotic use at some intermittent level, whether it's a urinary tract infection or respiratory infections that you're not even necessarily thinking about because it doesn't go alongside the gut, things that could be disturbing that aren't, that you're not going to be addressing if you simply just put on supplements. And I really appreciate that sort of insight and recognition of we have to really treat the terrain simultaneously while we maybe taking this, maybe gut-centric herbal approach. So, for you, in terms of those, layers, the low FODMAP diet certainly has gotten a lot of exposure and press. There's other things you kind of mentioned, just a general anti-inflammatory dietary template. What are you finding as the best sort of approach in general for folks with primary gut issues, or if you're trying to address issues like dysbiosis or SIBO?
So, I will definitely get into that. One other thought, I wonder your experience here.
Okay.
One thing I'm noticing is a higher number of patients with joint hypermobility syndrome with SIBO or hereditary EDS. I think there's a connective tissue disruption in the gut that's impairing motility. And I wonder if you've seen any of that or noticed that.
I can't say that I've really picked up on that, but it mechanistically makes sense. We certainly learn about it in school from folks with scleroderma and some of these connective tissue diseases that affect the esophagus, affect various parts of the GI tract. I probably need to be paying a little bit more attention to that association.
Well, that come in, the former, gymnasts, yoga people who are just hyper flexible. I'm just seeing a higher number of those people come in with SIBO.
Yeah. Yeah, I'll definitely put that down as something to pay attention to.
But you're asking about diet. So it really kind of depends on what they've done already and where they're starting from. If they're just eating a regular old crappy usual diet, then I'll usually start on a paleo diet. I find just good compliance here in Louisiana with a paleo diet.
Is fried chicken on the paleo diet in Louisiana and biscuits?
Yeah, not so much. The paleo diet, and then if they're not getting a response, and if by the time I've got their breath test back and it's positive, then I'll switch to a paleo low FODMAP diet. Those are the two of the more common approaches I use. I really enjoy working with diabetics on a ketogenic diet. And I do think there is a role for chronic gut patients who have been non-responsive for a ketogenic diet, but it's not for everybody. And I do think you have to be careful with monitoring lipids on this diet. But that's a whole other rabbit hole we could talk about.
We could certainly go there. So I think that's the blessing and curse of nutritional therapy is that, yes, it can be a beautiful approach and sometimes a necessary first step. But we also, and I'm sure you see too, folks who that's the only thing that their world is centered around, and trying to recognize, is this something where, what they're doing is getting them 98 99% of the way. And if I were to even try to tweak things such as removing certain FODMAPs or that's not where the emphasis of the treatment needs to go. It needs to maybe be in other areas such as sleep hygiene or in things to mitigate stress. And I just, it's certainly functional medicine can draw a certain type of patient. Obviously, it's there's been certain surveys that have showed what type of demographic is the most common individual seeking functional medicine. But outside of that, certainly there's a spread of things. So I was curious how you are balancing this nutritional approach in these different kind of scenarios.
Yeah, this is such an enjoyable conversation, Rob. I think we're on the same wavelength on a lot of areas. I have recently really been wondering if the majority of functional medicine dietary advice that's being given is more harmful than helpful. And I want to temper that with the statement that diet is one of the most powerful tools that we have to help a patient, diet and nutrition. But people are being kind of given fear-based advice that they can never eat a piece of gluten, they can never have a piece of cheese, any sugar, will flare their yeast overgrowth or, destroy their thyroid. People are panicked, and there is nothing that will make someone ill more than just worrying 24/7 about what they're eating. So while at the same time you have to be respectful and use the power of nutrition to help your patients, it's a fine line between getting someone on a healthy diet and having them go way overboard. I've had a few patients come in to see me where the only thing I needed to do was relax their diet.
Yeah.
And take them off supplements and just they needed to cool everything down and they were fine. So you're familiar with the term orthorexia?
Oh, yes. Yeah.
Yeah. So those orthorexic patients, there's just a certain people that I think you need to make sure that they're not being overly restrictive and doing more harm than good.
Yeah. Well, I've been thinking about this, and it was actually kind of brought to really my conscious awareness by one of my own patients this week, but to this idea of, on a macro level, seeing restriction potentially being detrimental depending on what stage the individual is at in their healing journey. So, yes, we're talking about sort of obviously food restriction, but taking that to other levels in terms of just overall, are they needing freedom? Are they needing expressivity? Are they needing creativity? Is what's lacking in their life social connection? And I'm can get into this sort of meta level, but really what it's looking at is like expansion and restrictive dieting, or restrictive nutritional approaches are simply sort of an example of that greater restrictive approach that might not be what's really necessary for an individual at that time in order to heal. And another sort of more practical perspective, I've had discussions, I want to get your thoughts of this too, of what in the value-based perspective, what is going to be the optimal treatment approach? And if we did a study and found that riding a bicycle for 30 minutes was like the best thing to do for your health, but walking for 30 minutes was good, but it just wasn't quite as good. But the bike that you needed to buy in order to achieve that was $1,000, but walking, you didn't need to pay anything. So I think, and this is sort of another direction I kind of want to go, but when is it okay to say that, maybe we don't need to go after the $1,000 bike, and we might, sacrifice a little bit on a theoretic perspective by just doing the walking. And this is, like I said, I'm kind of going on a tangent here, but how do we apply that principle into some of our approaches? Because I see a lot of folks doing tons of testing in the beginning, asking a lot of questions, or theoretically answering a lot of questions, and then getting a whole bunch of stuff that they don't fully, I think it kind of muddies the water. So how are you, I know that was a big jumble, how are you layering in this value-based approach, both from a testing perspective and from a therapy perspective?
For me, it comes down to listening to the patient. It's a combination of where they are in terms of their ability to make changes to get better, how enthusiastic and ready they are to make changes, and how sick they are. Someone with a TPO of 200 that has mild fatigue, you do not need to be throwing the kitchen sink at that patient.
Yeah.
and that's Hashimoto's thyroiditis. On the other hand, for someone with multiple autoimmune diseases and debilitating symptoms, that means they're getting out of the house for an hour a day at best. That person deserves a very comprehensive approach. So I think it's a real beautiful way that you put it. Thinking about, is lack or restriction not appropriate for a certain patient? And I think that's I think you nailed it. I don't think it's more complicated than that. I think some people are in a place where they need more added to their life, more social connectivity, more fun, more freedom. Simply eating a pizza once a week, with their buddies, that might be all they need to get better. It depends on the person.
As a young physician growing into the functional medicine space, it has been quite challenging to find younger colleagues like myself, taking a critical and moderating eye to emerging diagnostic and therapeutic approaches. It became very clear after connecting with Joe that we shared the same thoughtful and critical style, and we were both dying for a community and colleagues to help accelerate our clinical growth. With this podcast, our first collective foray into a critical discussion of functional medicine, it is clear that Joe will be an influential clinician in this greater functional medicine movement, helping us all to identify value-based root cause resolution approaches and avoid the pitfalls of needless testing and unsupported alternative therapies. It was Chris Kresser in one of his podcasts early on in my exploration of this space told a story about the individual who he needed the beer and pizza diet. When he came to him, he was eating like 6 foods because of all the testing and things he said he couldn't eat. And really what he needed was to go out and have a beer and a pizza a couple of days a week with his friends. And so I don't know. It's just, it totally, you're right. In one sense, it's totally upending the sort of functional nutrition approach that I think we both do agree on with certain aspects, but in other ways you have to have fluidity and dynamicism to your recognition.
It depends on your goal. So if your goal is results for the patient, then you're not as much tied to a particular approach, right? Mm-hmm. You just want what works for them. You want what's best for them, what's the lowest cost, most effective, best use of their time and energy. I think people get in trouble when they become dogmatic, when they say that the low FODMAP diet is the only way to treat IBS, and therefore if you're not feeling better, you need to do more low FODMAP. But those are the practitioners, I think, who get in trouble and cause this sort of nonsense. The people who are just stuck on one treatment or one therapy is the end all be all.
And so, and I agree with you. Sort of for the lay audience, let's perhaps. We've been kind of outlining a little bit, I think, of what we feel is maybe potentially harmful approaches in the functional medicine space. So being positively critical, maybe we can go into discussion now of what you feel is some of the areas that need refining and editing, or perhaps modification in the functional medicine space. Or maybe sort of tied to that are, what are things that you're seeing your patients coming in taking or doing that are potentially misguided or misinformed?
And I think, so I guess functional medicine is a new field, and every single practitioner is going to have different areas of expertise where they really can help their patients. So I don't want to come across as too harsh or critical on any individual approach, because we're all learning. 10 years ago, there was not a area in the consciousness where people were thinking of what causes disease. But there is now. So people are learning and hopefully adjusting their approaches to what works. Right now, my biggest pet peeve is just food sensitivity testing, because I don't find it helpful.
Yeah.
And I see people coming in just being absolutely freaked out, scared, restrictive, and not eating enough food, proper food, and just terrified of eating any food that was on their food allergy panel. So I spend a good amount of time each week actively discouraging patients from doing that testing.
Nice. Okay.
Is that a good enough example?
That's a good example. Yeah. I can almost ditto you there. So.
And I guess bigger picture functional medicine, I think we need less dogmatism on specific treatments and more big picture analysis of the patient. I think practitioners are I see people getting really bogged down with like MTHFR genetics, where it might be a problem, but for most people, I just am not convinced yet that it is. I think we need practitioners who are broadly trained and can think, don't miss the forest for the trees, I suppose.
Yeah. Well, I know I totally specifically can agree with you on the sort of food sensitivity realm. I think it can be incredibly challenging. And I know there's some emerging tests trying to look at more specifically maybe the antibody response that's invoking a complement or inflammatory, a true maybe inflammatory immune response, as compared to simply just looking at, IgG antibodies.
Do you know the name of that lab?
Yeah, so it's KBMO. It's their FIT test. Kara Fitzgerald, who is she's, I think, a wonderful leader in the space, very thought-provoking and critical. She's had a couple individuals on talking about this new test. I personally haven't utilized it. I mean, I'm not utilizing food sensitivity testing very often because it's just not high up in my hierarchy of what's being a game changer. But the mechanisms and initial research or clinical study from in connection with this test seems to point that maybe this is more helpful. But I also see, once again, let's fall back to the restrictive paradigm. It's even more specific than the sort of what people are critically saying are non-specific about these food sensitivity tests that come back right with 37 foods, including blueberries, that you need to avoid eating. And it's like, really, can we am I truly allergic to blueberries? I'd
be much more interested in that test. One of the things I've been thinking about, and I'm going to experiment on myself before I torture my patients.
Yeah,
is a continuous glucose monitor.
Yes,
and just to be able to track my glucose response to certain foods, because I think that's a missed issue, where just because we think that a certain food might be healthy, if it's causing an undue glucose and insulin response, I think that's metabolically harmful. So that's one of the things on my radar for interested patients that I want to start working with, is just getting a real close idea of what's happening to the blood sugar in real time.
Yeah, no, I think and I think it harkens to aspects of what Ruscio puts in his book, which I agree with. Is when we think about any food in a therapeutic context, I'm thinking about the added nutrient value. So what nutrients does that food contain? What is it doing to the gut? Either is it promoting maybe growth of bacteria, the bacteria that are there? What is it doing to blood sugar, which you just sort of said? Because all of these, and then kind of tied with the gut, is there an inflammatory response to a true allergenic component of the food? Because all of these things iteratively are going to create cascade of an immune response, an inflammatory response that's going to cause issues in the organism. And I think as soon as you start to measure one, at least from what I see in this space, as soon as you start to measure one or feel like you have a good handle of being able to measure one, you forget about the other things. So that's what happens, right, with these food sensitivity tests, is we see this must be all of the source of inflammation coming from these food sensitivities, when in reality you haven't even been recognizing, because you haven't been measuring it, what could be happening just simply related to blood sugar imbalances. And we have a lot more data and research on the inflammatory effects of blood sugar because of all of the research with, diabetes. So I love the idea of having the glucose monitor to potentially look. And there's been that, initial research too, looking at, there's a huge variety, a variation between individual if their response to certain foods. So certain good foods you might have a crazy response to, and certain bad foods like ice cream, you might look like you're a normal person and not diabetic. But
I would love if my result is positive for ice cream. We'll see what happens.
But yeah, so that was a lot there. But this bigger picture of what do we eat? What's the purpose of the food that we're consuming? But really, once again, are we getting too restrictive just because we look at this one test, because that's the only thing that we are doing in practice, or that's the only information we have? We forget the larger picture of what else could be going on. And I agree with you that I think blood sugar imbalances related to either poor sleep or these dietary sources is probably maybe a bigger player than what is portrayed from most of the food sensitivity testing, at least right now.
I think I mean, you and I both come from family practice backgrounds, and you really, once you've got a patient better, and let's say their IBS or their autoimmunity is in check and they're feeling better, well, they want to pivot to, how do I feel better for as long as possible? How do I optimize my health span, my lifespan? I want to live a long time. Well, guess what? If you're eating a ketogenic diet and your LDL particle count is 2,000, that's probably not a great long-term strategy, and you probably need to adjust there. And if your blood sugar your A1C is riding just a little bit high, that adds up over time. And so, immediately in functional medicine, we want people feeling better, but I think there comes a point where a physician wants to help someone make good long-term preventative health choices as well, and use those, more conventional tools in a sense to manage long-term risk.
Yeah. And I think that's the natural iterative process, right? Someone comes to you with a high symptom burden. They're not necessarily interested in starting a meditation practice, depending on what's going on. But, once you start to peel away some of those layers of the onion, or put back the other way, put the layers back on to really get this person feeling whole and healthy, then they start asking those questions, right? As you just said, how can I get into a contemplative practice? How can I expand my spirituality to encompass things that maybe I'm not doing now? These sort of, we might say, like next level aspects of healing that were just inaccessible when the symptom burden was just so profound. And that's really, that's what's going to make a difference, I think, in this greater movement, is getting people. And yes, if you can get someone to that stage in 6 months versus a year, maybe you're a better clinician, but that time doesn't really matter. It's really, you're going to get someone there following these principles at some point. That area is somewhere that, in traditional settings, maybe would never be reached because someone is just perpetually in a state of chronic disease suppression. But that's going to really see what I believe is what's going to separate folks in this space. And curious, since you brought it up, what are things that maybe your conversations or approaches that you're having with individuals that are making that progression or asking about? Because that too is a whole other can of worms of anti-aging medicine and all these bells and whistles that we could be doing. But what's your experience been, and what's been your approach?
So for me, if a patient is either at the place where they're trying to prevent disease or they come to me for a prevention, then you want to think about what are the things that are most likely to kill a patient.
Yeah.
And so, and how do you start thinking about ways to reduce that risk? And so the things that might kill that patient, usually there's a family history, one way or the other, that's going to influence you. The metabolic labs, advanced lipids and Lp(a) and blood sugar, homocysteine, they point you to more cardiovascular risk. Dementia and Alzheimer's disease is something that I feel very strongly about. And really been influenced by Dr. Bredesen's work. And so, look, if you can not get Alzheimer's or push it 10 years down the road or change the fundamentals of your life so that that's not going to be on the horizon at all, then I think you've got a duty to, as a clinician, to bring that to people. So the vascular disease point, it's such a preventable deal. And this is, I prescribe statins and Zetia and PCSK9 inhibitors. I know it's not standard functional medicine, but if you're looking for, again, results for patients, then I think you are, you need to follow the evidence where it leads you. And for a lot of patients, statins prolong life and preserve brain, prevent vascular events, reduce the risk of heart attacks. And so for the right patient, not for everybody, not in the drinking water, but for the right patient, I think you need to be open to those tools where appropriate. Does that make sense, Rob?
Yeah, it does. And I think,
what do you think? Where are you on that? Functional medicine versus conventional?
Yeah, I completely agree with you in terms of, how can I find the middle way, the middle road, to really not just sort of blanketly say all medicines are the devil, or
right.
This is a failure on behalf, from a patient perspective. I'm a failure if I'm having to take a medicine. In certain instances, and this is where we have to put on our thinking caps, I think, as physicians, what's truly happening physiologically with this medication? How targeted of a therapy is it? And if I'm going to use it, well, then I'm going to make sure that I'm ensuring if there's any potential nutrient deficiencies related to it, that I'm going to either test for those or augment those. So enhancing my awareness of what we're considering adverse effects or our potential issues related to, whether it's nutrients or what have you, to using that medication. So I feel more empowered when I feel I need to use a medication because I'm looking and I'm aware of other things that could be going on in relation to that, versus like if I didn't have that information and I was, quote, taking a functional medicine perspective or just any kind of medicine perspective, I'd be a little bit more reluctant. In general, I say, like, if I'm going to use a medicine, I want as much information as possible. If I'm going to use an herb or a nutrient, I can get by with clinical information or information from maybe in a physical exam guiding what I see as a nutritional state. But if I'm really going to want to prescribe a medicine, which I'm totally willing to do, I just want more information and putting it into a greater context. Because, I just think it doesn't do the patient and this greater movement justice to simply put things into a basket saying, nope, I'm not going to touch those or use those because of that label.
Well, I think a lot of us got into this space because we were frustrated with the approach of just handing out pills for symptoms. And so that's where I think a lot of us physicians just that's not what we've signed up to do. But at the same time, I think every patient wants all of the tools available to them that are reasonable. So, and every patient wants to not take medicine. And so from a functional medicine perspective, if we can offer them the proper lifestyle and proper analysis of root cause, many of them won't need medicine. But I also think that there shouldn't be shame. If you have a genetic predisposition to high Lp(a), you should probably think harder about really lowering your cholesterol in other ways. If you have ApoE and you're at higher risk for Alzheimer's, you probably want to start changing your decision a little bit. And so for me, it just comes to trying to balance, short-term getting a patient well with helping them enjoy their life for as long as they can. Yeah.
And I'll put this sort of, kind of playing a somewhat devil's advocate too on the functional medicine space. We're trying to be as positively critical, as we can is, what is the actual total body burden when you think about supplements? And I'm really talking about not the compound itself that you're taking it for, but everything else that's in the supplement. And I just see that as, we truly, if you want to be honest, that has to have been studied in the same way that we really also haven't studied like combinations of medications, which is commonplace. That's a big, issue for me, is that, a lot of these medications that we're utilizing aren't studied in the 4 or 5 different combinations that they're commonly being used. And we're trying to assume that we understand all the, what's happening in those and using it in that way. But in the same way, we definitely don't have the data on how some certain supplements. And I just, I don't know, this is
a target-rich conversation. I have a patient that just came into my practice recently. She was taking 96 capsules, tablets, supplements a day.
96
capsules of supplements a day. And to me, there's just no way that is good for a person. And so we need to be very careful that we're not practicing, green medicine, where instead of prescribing medicines, we just throw supplements, which can have effect and help. But I think we just need to be more cognizant of what that could be doing to a patient. So there is some suggestion in the literature that magnesium stearate, the excipient for many supplements, can cause leaky gut and can cause impaired nutrient absorption. Magnesium stearate is the compound that they use to help package the supplements so that they fly through the machine better. They can make more supplements per hour. Yeah. But if you have a capsule and binders and excipients and additional additives, if it's not a high quality supplement, that stuff adds up. And I think a body burden is a good term for it. One of the things that I appreciate most about Dr. Ruscio's approach is evaluating a supplement for effectiveness and periodically discontinuing that supplement, trialing a discontinuation, because, if a patient's gut is better, then oftentimes they don't need what they needed initially to get better. 3-6 months later, they just don't need that stuff because they're healthier people. So that to me is a really important message, is that, supplements, people think they're harmless because they're natural, but there are some real consequences of these things. We're seeing antibiotic resistance being measured now from herbal antimicrobials. And just like we worry about antibiotic resistance from pharmaceuticals, but why would a bacterium not try to upregulate pathways to make itself not die from oregano, for example? Of course it would. So we just got to be careful that we're not creating superbugs with our excessive supplementation.
Yeah. Well, and you just hit on this is probably myself and then my partner, Ryan Hall, in our practice, the area that we feel probably the strongest about in terms of, because these supplements are ubiquitous and pretty much anyone can get their hand on whatever supplement that they want, for good or for bad. But I certainly get really leery about the just extensive use of these herbal antimicrobials, because in some ways, it's like you just said, it's the same kind of thing as if they just got an antibiotic. And while, someone listening is like, that's not true. This is completely not the same thing. Well, mechanistically, what we're seeing, as you just said, a similar response is happening from these, herbal products. And it can do, you can do a decent amount of harm to your gut and the overall ecosystem by being on something for 6 months that you read about or heard on a podcast or another show that said this could be helpful for leaky gut, dysbiosis, what have you. And so that class I'm really worried about. And I also worry a little bit about, just because I've been seeing it more when I do testing, is, vitamin D levels. And that's certainly something that I'm seeing, because once again, from a fear, everyone's deficient. So everyone needs to be on vitamin D. Seeing levels in the 70s, 80s, and 90s with a couple instances, actual true low-level hypercalcemia. And it just...
That's an excellent one. This is one where the field, actually, I think medicine in general, I don't think this is unique to functional medicine, because I think there's kind of a vitamin D craze all over the place. But are you aware of any of the analysis showing high dose vitamin D supplementation increases the risk of Alzheimer's dementia, or that increased cardiovascular risk directly?
You said stroke? D or vitamin B?
High dose vitamin D. So
vitamin D.
5 or 10,000 a day.
Mm-hmm.
Used for a long enough time is increasing risk of heart attack, stroke, and Alzheimer's.
Wow.
So, 5 to 10,000 a day. If someone's taking 5,000 a day, they're probably going to be, I don't know what your experience is, I somewhere around 75, 90, something like that. But man, I saw a patient recently, 105, taking so much vitamin D.
Yeah.
And there's no need for it. This isn't a thing that I have seen success with in just supplementing D. I've never noticed someone get markedly better from that. So I think it's something to think about, but I'm skeptical of the high dose approach. I'm sure you've seen cases where someone comes in nutrient deficient, inflamed, poor gut. You fix that, and the vitamin D goes up naturally without supplementation.
Correct.
Is a low vitamin D a deficiency, or is it just a sign of poor health?
I agree that I see it as a surrogate. I see it as a sign, right, of the system. It's being utilized. If we recognize what's going through the system, what it's being asked to do, to me, I see it as a sign of, once again, like dysbiosis can be a sign of the overall terrain being disrupted. And that might actually be improved by other therapies. And so I'm seeing it, unless it's like, even when it is super, super deficient, and if I'm going to replace it, I'm doing it in concert with the other fat-soluble vitamins. So really, I don't think I've never just prescribed vitamin D, even in a low dose by itself. I think I've always done it with a form of cod liver oil, or if I'm really needing a little bit more, with a vitamin D sort of K2 combination. And wanting to be aware too of, I've seen in a couple instances, someone on higher doses who has completely discordant vitamin 25 versus the vitamin, there's the classic, when someone says their vitamin D level, it's the 25 hydroxy, which is sort of more stable and easier to measure in the lab. But that actually gets further modified by the kidney, and really that's into this 125 form, which is the bioactive form. And if there's a huge discordance there, and there's some interesting literature about, certain infections, bacteria evolving to block the vitamin D receptor to sort of create this kind of upregulation, where you can have this huge discordance from the vitamin 125 being very, very high, and the vitamin D, which you keep supplementing because it stays low, is actually being converted, but it can't actually have its activity because the receptor is being blocked. So essentially, by giving vitamin D, you're kind of fueling a fire.
Rob, I don't think I've ordered a 125 vitamin D in my entire career.
I did it until, and like I said, back to that information paradigm. If I'm really going to be supplementing or watching something, or I have a suspicion that there's something going on that's causing someone to be resistant to this level, even with other approaches going up, then I get really interested and I measure it.
So would that be like a chronic viral infection that you would? The
literature I'm seeing is actually, it's more of chronic bacterial infections, but I think mechanistically, they fall under a similar paradigm. After the show, I'll send you one of the main articles I was reading about it. But yeah, so things like mycoplasma and some arguments. I haven't seen this positively in the literature, but with Lyme. But there's some arguments that certainly it's a mechanism, once again, of some alteration in the immune system, but you're getting essentially a blockage of the effect of vitamin D at the receptor site, so you create resistance, and then that has a downstream effect of what the body tries to do to correct it. So if you just keep giving vitamin D, and then that's further dysregulating the whole balance of the other fat-soluble vitamins. So yeah, there's a lot of harm that can be done by...
Yeah, I saw a mechanism patient on a mechanism paper on EBV.
Okay.
EBV, I forget how manipulating or changing the vitamin D receptor. And so that being a way that it avoids immune system detection. So are you ordering the 125 if you're supplementing vitamin D and just not seeing it rise? You just check the active metabolite?
So usually if I'm going to initiate therapy, or if someone comes to me with a high level, or either a really high level or really low level, I'm sometimes triggered to go check it and see. So it's kind of putting that picture together. Do I feel like this is a driver? Is there some chronic immune burden, chronic sort of viral bacterial burden that might be dysregulating the immune system, causing this discordance? But if someone's level is staying really, really low, even with some degree of supplementation, or they're coming to me really, really high, I'm really just sort of curious to see, is there a huge discordance here? Because I don't know, it just
interesting.
Well, we spent about almost a little under an hour here just kind of geeking out. I mean, I could keep doing this the whole day, and I'm sure hopefully this added value to folks listening, both as health professionals or kind of a lay audience. But I wanted to give you at least some space here to end with perhaps any two things: any final thoughts or things that you had on your mind, and then also how can people sort of follow you, either as a practitioner or work with you directly in the Louisiana area? Yeah,
well, they can find me. My website is www.drmather.com. It's DoctorMather. That's the best way to find me. And I'm outside of New Orleans. I was curious. It's always a pleasure to talk to someone else with a similar philosophy, Rob. I'm curious if you have any thoughts of where the functional medicine field will be in 5 years that's different than today.
Yeah. Well, my wish, and I hope to be a part of it, is two things. One is I think we need to revamp and change education. And this is just in the traditional space, a huge disillusionment and agreement that, residency education and even medical school education is just insufficient for the demands that we face. And I think everyone in the functional medicine space can kind of agree that, what you're being taught in medical school is not always helpful for what you're really seeking to do with patients. So clearly we have a system that's creating individuals either that are burned out or uninformed about the ways to really help people. And so I hope that we can shift this movement to one that's a little more collaborative and and that we can really change medical education. I'd love to be a part of the first functional medicine residency program, or creating an education so that if someone knew very early on in medical school that they wanted to pursue this sort of more preventative functional medicine route, they could do it, and they wouldn't have to spend 8 years with medical school and residency going into something and learning things that wouldn't be really applicable to their skill set. So I think we have to, I would hope to be a part of that. And then sort of second is just further clinical research into real clinical approaches, what I see as really patient-centered research. And that could also include on specific supplements. I think there's a big gap between the research on amounts of certain supplements and what's actually being used. I mean, there's so much that comes out there, and I find it very difficult and challenging sometimes to search through and say, well, is this this supplement with these combination of things actually going to do the same thing that research study did? And maybe it would be a way to start to bring more efficacy to this movement that right now isn't regulated. I mean, the FDA doesn't regulate supplements. So is there some way that we can bring about a better way to really make supplementation more rigorous? And it's going to elevate the standards of these companies if there's starts to be independent research on their products, comparing it to either other products or other therapies to really nail down, is this actually doing anything? So that guru over here with 200,000 followers isn't the reason that your product is being used. It's actually being used because it was in a double-blind placebo-controlled study that showed efficacy specifically of your product. So I mean, those are the two things that I want, and I'm directly already actively trying to be a part of, that I hope or where this movement goes, because that's only going to strengthen the ability for this to really impact people's lives positively.
Yeah. I had heard rumors of a medical school in Ohio that was incorporating some functional medicine training into their curriculum.
I need to know more.
I think it's so Dr. Hyman's at the Cleveland Clinic, I believe.
Oh yeah.
I think it's in conjunction with, they'll either be sending some students there, rotating through the clinic, or something more formal. That's all I know.
Yeah.
But that might be a good place to start, man.
Yeah. What do you hope? And reciprocating to maybe end the conversation, what do you imagine and see this space moving towards in the next 5 years?
I think it'll naturally. I think the best practices need to be updated a little bit. I'd like it to be more patient-oriented, results-oriented, rather than dogma, guru advice.
Yeah.
I see a lot of brilliant clinicians who really advance the field, but what happens in this internet age is that whatever they say is treated as gospel, and people aren't thinking constructively about if that may or may not apply to their own patients. They're just kind of just applying blindly their advice. And, some of these gurus are working in tertiary academic centers where they may be seeing the sickest of the sick, and their approach just isn't needed for the general population. They can scale back and really find the best practices. The Bredesen protocol we're seeing in reverse Alzheimer's. I'd love to see that continue to get modified. Maybe we can find the 75% of the protocol there that really is pushing the limit, and maybe cut out some of the stuff that's just extra, just to simplify these treatment protocols for patients. And for me personally, the last thing I'll say is group visits. I think that's something that is one of my goals this year, is to begin doing, just to reach more people. And I think there's power in a group dynamic that is different than just a one-on-one doctor-patient visit, which won't go away, but that's kind of my interest right now.
I couldn't, once again, I feel like I keep saying this on repeat. I couldn't agree more. I feel that's I've been a part of a research study and continue to be a part of research utilizing group community structures because of the therapeutic potential, independent of what you're actually doing. Getting back to that, humans are social creatures, and needing to be heard, to have validation, to share your story. So I totally see that as being a game-changing piece to really scale this and make meaningful patient-centered results. So
awesome.
Yeah. Joe, I think we're going to need to really have more of these conversations. I think hopefully people enjoyed this. I think there's just a lot can come out of this spontaneity, this back and forth,
I hope
really
so.
being positively critical and sharing of ideas. I mean, this is how movements start and move forward. So thank you for joining me.
Yeah, my pleasure, Rob. Anytime.
Well, great. Well, I will talk with you again soon. And yeah, we need to do a part 2 sooner rather than later. So thanks, Joe.
Fantastic. Talk to you later.
Thank you for your presence and willingness to receive a new narrative, a passionate perspective, and perhaps a deeper sense of connection with our collective purpose. Please share this podcast with any and all that you believe will benefit from its intention to relieve one's doing and engage one's being. Please share your comments about the conversation on our podcast page and leave a review in iTunes so that the voices in this space can spread to all ears ready to receive it. Music credit goes to Dillingham for their song Vessel. Remain open, stay curious, and forever be love.
You walked on fire, and I know you tried.